Welcome to the Global Health module. Before beginning this module, make sure that you have read the required readings listed. If you have not, click on the links here to access those readings. This module will last approximately 90 minutes, not including the readings, and will incorporate required quiz questions throughout it. Press the arrow button to begin. Global health is a critical topic and an important part of this course no matter where you are doing your clinical. Learning in global health will assist you in your nursing career because it helps you understand the complexity of the world and will assist you in taking care of patients no matter where they are from or what they have experienced. This is a brief overview of global health issues. There are entire courses on these topics. The goal of this module is to just give you a very basic understanding of the key concepts. Your clinical instructors may provide you with additional information specific to your population. This module provides an overview. The objectives of this module are listed above. Let's start with what is globalization and why we live in a global world. As Jenkins states above, we are constantly on the move. People, goods, technology, etc. We have improved communication, internet and cell phones, that keep us more connected of what is going on in the world. There are 3 recent examples. First, the measles outbreak in Salt Lake City in 2011. It has been traced back to a family who went to Poland to pick up their daughter from her mission. The daughter was immunized, or she would not have been allowed to leave the country on her mission. However, the rest of the family was not. They were exposed to measles while in Poland and brought it back with them to the U.S. Second, the earthquakes in Japan triggered a tsunami that hit Hawaii and the West Coast. In addition, the concern of radiation from the nuclear power plant caused a rush on potassium chloride in pharmacies right here in Utah. Final example, in 2010, a volcano erupted in Iceland, but it impacted health across all of Europe. The ash cloud from the volcano grounded flights across the continent. Pilots could not see. Travelers were stranded for days. In addition, the bad air caused concerns related to asthma and other respiratory conditions. It went further than that. A lot of fruit in Europe is imported in from Africa, but because of the grounded flights, they were not able to ship fruit, vegetables, or flowers to Europe, and so the fruit and veggies spoiled in warehouses in Africa. It impacted the health of the Europeans because they were not getting the fresh fruit they were used to. But then it was also very economically damaging to the people who grew the fruit in Africa because they were losing money, not being able to sell their fruit and other items. And all because of a volcano thousands of miles away. The point is, we are impacted by what happens in the rest of the world, not just with natural disasters, but with wars, sicknesses, and economics. As future nurses and concerned citizens of the world, we need to know what is happening around us because it impacts us, whether we want it to or not. According to Healthy People 2020, improving global health can improve health in the United States and support national and global security interests by fostering political stability, diplomacy, and economic growth worldwide. Global health plays an increasingly crucial role in global security and the security of the U.S. population. As the world and its economies become increasingly globalized, including extensive international travel and commerce, it is necessary to think about health in a global context. The 2007 World Health Report notes that since the 1970s, newly emerging diseases have been identified at the unprecedented rate of 1 or more per year. The Institute of Medicine's 2003 report, Microbial Threats to Health, stresses that the United States should enhance the global capacity for responding to infectious disease threats and should take a leadership role in promoting a comprehensive, global, real-time infectious disease surveillance system. Rapid identification and control of emerging infectious diseases helps promote health abroad, prevent the international spread of disease, and protect the health of the U.S. population. Communicable disease has always been the traditional global health issue because of the spread. The most recent example was the spread of H1N1 in 2010. It was traced back to Mexico, but to an area where there were lots of travelers visiting. It quickly spread to North and South America, as well as Europe and the rest of the world. Many people thought public health officials overreacted. However, our past history of influenza and the threat of a pandemic flu, like the one in 1918, was on many public health officials' minds. They knew how quickly the disease could spread. They knew how deadly it could be. And they also knew that influenzas tend to cycle over time, and we are long past due for a large outbreak. Why did it not spread? Technology spread the word quicker, and so countries were on the lookout, knew what to be looking for, were able to track the diseases, and a vaccination was provided. The World Health Organization, WHO, and Healthy People 2020 have identified some of the key global health issues we face. They include not just communicable disease, tuberculosis, malaria, H1N1, HIV/AIDS, etc., but also chronic disease, such as obesity, diabetes, heart disease, mental illness, Alzheimer's, anemia, bipolar disorders, and so on, substance abuse of drugs, alcohol, and tobacco, injuries, medication distribution, the accessibility and cost, and human rights. In the past, much of global health focuses on communicable diseases spreading between countries. However, chronic conditions, especially if they are influenced by one's lifestyle, are among the leading causes of disability worldwide. It is important to study not only what conditions are spreading around the world, but how various countries address each issue. We can learn a lot from each other. This is another reason why you will be doing the Global Health Assignment. The purpose of your Global Health Assignment is to further learn about some of these major health issues, find out what is being done about them, and how culture impacts these conditions. It is also to illustrate that we may be different, but we are also similar in many ways. The next two slides address two very common communicable diseases that impact the world: tuberculosis and HIV/AIDS. I have included them because it is important to have a basic understanding of them and how they impact health. A major communicable disease and global health issue is tuberculosis. This map indicates that certain parts of the world have much higher rates than others. It also shows that the disease is prevalent everywhere, including the United States. Experts estimate that one person is infected with TB every second, and there are an estimated 4,400 deaths per day caused by TB. If left untreated, each person with active TB will infect on average between 10 and 15 individuals every single year. Tuberculosis is a communicable disease that spreads through droplets in the air. It can be life-threatening. Our great concern is that it has developed into drug-resistant strains. According to the CDC, resistance to TB drugs can occur when these drugs are misused or mismanaged. Examples include when patients do not complete their full course of treatment, when healthcare providers prescribe the wrong treatment, the wrong dose, or wrong length of time for taking the drugs, when the supply of drugs is not always available, or when the drugs are of poor quality. Risk factors include living in poverty, malnutrition, employment, geographic location, age, and immunity level. Another concern is that approximately 1/3 of the 40 million people with HIV/AIDS also has TB. TB is the leading killer among persons with HIV/AIDS. This leads us to another global health concern: HIV/AIDS. Like TB, it can be found in certain parts of the world, impacts some of the poorest countries, and has become drug-resistant. From the Global Health Council's fact sheet on HIV/AIDS, the impact of HIV/AIDS over the past 27 years, nearly 25 million people have died from AIDS. HIV/AIDS causes debilitating illness and premature death in people during their prime years of life and has devastated families and communities. Further, HIV/AIDS has complicated efforts to fight poverty, improve health, and promote development by diminishing a person's ability to support, work, and provide for his or her family. At the same time, treatment and healthcare costs related to HIV/AIDS consume household incomes. The combined effect of reduced income and increased costs impoverishes individuals and households, deepening socioeconomic and gender disparities. Women are at high risk of infection and have few options for providing for their families. Children affected by HIV/AIDS, due to their own infection or parental illness or death, are less likely to receive an education as they leave school to care for ailing parents and younger siblings, straining the resources of communities, hospitals, social services, schools, and businesses. Healthcare workers, teachers, and business and government leaders have been lost to HIV/AIDS. The impact of diminished productivity is felt on a national scale. Through unprecedented global attention and intervention efforts, the rate of new HIV infections has slowed and prevalence rates have leveled off globally and in many regions. Despite the progress seen in some countries and regions, the total number of people living with HIV continues to rise. In 2008, globally, about 2 million people died of AIDS, 33.4 million were living with HIV, and 2.7 million people were newly infected with the virus. HIV infections and AIDS deaths are unevenly distributed geographically, and the nature of the epidemics vary by region. Epidemics are abating in some countries and burgeoning in others. More than 90% of people with HIV are living in the developing world. There is growing recognition that the virus does not discriminate by age, race, gender, ethnicity, sexual orientation, or socioeconomic status. Everyone is susceptible. However, certain groups are at particular risk of HIV, including men who have had sex with men, injecting drug users, and commercial sex workers. The impact of HIV/AIDS on women and girls has been particularly devastating. Women and girls now comprise 50% of those aged 15 and older living with HIV. The impact of HIV/AIDS on children and young people is a severe and growing problem. In 2008, 430,000 children under age 15 were infected with HIV and 280,000 died of AIDS. In addition, about 15 million children have lost one or both parents due to the disease. There are effective prevention and treatment interventions, as well as research efforts to develop new approaches, medications, and vaccines. Global funding is increasing, but global need is growing even faster, widening the funding gap. Services and funding are disproportionately available in developed countries. To give you a better picture of the impact of diseases worldwide, here are the top 10 causes of death worldwide. As you can see, heart disease is number 1. Note that lower respiratory infections is 3rd, diarrheal disease is 5th, HIV/AIDS 6th, tuberculosis 8th, diabetes 9th, and road traffic accidents is 10th. Depending on your population for ghhd, you may learn more about these various diseases. Now let's compare the top 10 causes of death in low, middle, and high-income countries. The leading cause of death is lower respiratory infections. This is in comparison to ischemic heart disease in middle and high-income families. It is important to note how chronic diseases such as heart disease is now replacing infectious disease as the number 1 killer in many underdeveloped countries. This is a new phenomenon. Many of the conditions listed are preventable. It is for this reason we emphasize education and health promotion. It is also important to learn more about these conditions and their impact on society. The chart on the slide before indicates diarrhea is the second leading cause of death in low-income countries. One of the contributing factors to this is the issue of personal hygiene, hand washing, and also water sanitation. We saw this with the earthquake in Haiti, when the water supply was contaminated with cholera. Another issue related to water and global health is the increasing population of areas like Las Vegas and areas of Arizona. The rising population is requiring piping water in from surrounding areas. One of the areas most greatly impacted are the Native American reservations. There is not a lot of water to spare, but large companies are coming and piping the water out. This has created issues beyond just lack of water and poor health for the people living on the reservations. There is the cultural issue because the land and environment is part of who the people are. Their very culture is being taken away from them. I bring this up so we do not forget a key principle of this course, the importance of culture, values, and beliefs on health. Another global health concern, often related to diarrhea but not always, is malnutrition, especially in children. It is often a comorbidity to many other healthcare issues. Side effects of malnutrition include decreased resistance to infection, difficulty overcoming bouts of diarrhea, failure to thrive and physically grow, problems with balance, coordination, and intellectual ability, muscle twitches, and anemia. Researchers are still investigating all the long-term effects of malnutrition, but a few include lower IQ, inability to absorb nutrients in the intestine, mental retardation, greater than 20% of maternal death due to anemia in Africa and Asia, low birth weight babies, modified intrauterine programming, adverse reproductive outcomes, and the intergenerational transmission of deficits, hypertension, type 2 diabetes, schizophrenia, and other mental health disorders from a study conducted in Barbados of children who were malnourished, as well as blindness and maternal morbidity because of vitamin A deficiency. Physical symptoms of malnutrition to watch for include anemia, dry peeling skin, normal height but thin arms and legs, distended liver, hair yellowish or reddish, loss of appetite, skin that is dry and baggy, low body temperature, and slow pulse and breathing rates. Another global health issue that plagues many countries is teen pregnancy. Approximately 11% of all infants in the world are born to teens. The average teen birth rate in middle-income countries is more than 2 times that of high-income countries. The rate of teen births in low-income countries is 5 times higher than that of high-income countries. Although cultural beliefs influence the age in which a person marries, more and more pregnancies are to mothers out of wedlock, many due to rape and forced sex. Teen pregnancies influence the maternal and child mortality rates of a country, as many teens' bodies are not developed sufficiently to carry and successfully deliver a healthy baby. Teens often do not receive the prenatal care needed to identify potential problems. Although not a disease, it is a societal condition that also impacts global health. Since many of the ghhd sites work with mother-baby, it is an issue many will encounter. The Global Burden of Disease is a report published regularly by the WHO. It compares diseases, economics, and environments across countries. The first versions of the report were printed in the 1990s. They are not published every year, but they are starting to be distributed more regularly. These reports are an excellent way of sharing information regarding the disease, the environment, and the burden placed on others. The reports examine rural versus urban areas, various socioeconomic areas, and the impact on ethnic minorities. It also investigates the impact of disease related to education level and the different genders. The World Health Organization has a website regarding this. It can be found at the link provided here. On the WHO Global Health website, it lists the top 10 facts related to the global burden of disease. These facts are: 1. 10 million children under the age of 5 die each year, usually from preventable causes. 2. At least 80% of premature deaths from cardiovascular heart disease and strokes could be prevented through healthy diet, regular exercise, and not using tobacco. 3. HIV/AIDS is the leading cause of adult death in Africa. 4. Population aging is contributing to the rise in cancer and heart diseases. This impacts not just the older people, but the entire economy, the families, caregivers, etc. 5. Lung cancer is the most common cause of death from cancer in the world, and tobacco is the single largest preventable cause of cancer in the world. In developing countries, smoking is responsible for more than 80% of all lung cancers. 6. Complications of pregnancy account for almost 15% of deaths in women of reproductive age worldwide. Many of the deaths could have been prevented. 7. Mental disorders, such as depression, are among the 20 leading causes of disability worldwide. 8. Hearing loss, vision problems, and mental disorders are the most common causes of disabilities. They affect people's lives and livelihoods, but again, many of these are treated, for example, hearing loss and cataracts. Statistics vary between the higher and the lower socioeconomic countries, and so a huge disparity exists. 9. Road traffic injuries are reported to rise from the 9th leading cause of death globally in 2004 to the 5th in 2030, and it just continues to rise. Look where prevention could be included there, with wearing helmets, seatbelts, not speeding, not driving under the influence of alcohol, and so on. 10. Undernutrition is the underlying cause of death for at least 30% of all children under 5. Going back to the number 1, where 10 million children under the age of 5 die each year, at least 30% of all those deaths have an underlying cause of undernutrition. This includes inadequate breastfeeding, inappropriate food, and lack of access to highly nutritious foods. This is a major issue, especially when we realize some of the historical practices that have taken place to help some of the poorer countries. We can really learn from mistakes such as the Nestle formula war. Back in the 1970s, Nestle decided they would empower and modernize the women of South America by teaching them about baby formula. Can you think of all the ramifications? First are the issues of immunity and health related to breastfeeding. In addition, remember many of these areas do not have clean water. Formula needs to be mixed with water. Nestle taught the people to boil the water, which most did. However, there was still the issue of using water to wash the bottles. Nestle originally donated the supplies and formula to the women, however, it was for a limited time. Formula is expensive, and so they started diluting the bottles so the formula lasted longer, causing malnutrition for the babies. The impact of this experience is still seen in many areas of South America. It has taken a lot of time, money, and resources to help convince the women that breastfeeding really was the better option. It is still a fight in some areas. This is not isolated to just South America, as more immigrants come to the U.S. We continue to battle perceptions regarding breastfeeding, even here. We need to be careful how we infuse beliefs and practices on other people. The implications can have long-lasting effects. The WHO published a code of ethics regarding the marketing of formulas in 1981. An important part of understanding the burden of disease is to learn how they measure it. It is often measured in DALYs, which stands for the Disability Adjusted Life Year. One DALY can be thought of as one lost year of healthy life. The sum of these DALYs across the population, or the burden of disease, can be thought of as a measurement of the gap between current health status and an ideal health situation, where the entire population lives to an advanced age, free of disease and disability. In other words, instead of just measuring mortality, death, it is helpful to account for the number of years of quality of life that are lost due to a disease. This is what the DALY measures. You do not need to calculate DALYs, but you will see the term used a lot, and so it is important to have a basic understanding of what it means. DALYs is the gold standard for calculating burden. Other factors are also examined, such as infant mortality, rates of poverty, rates of injury, as well as risk factors. Although the World Health Organization is the leader regarding the global burden of health reports, there have been some alternate reports that are just as helpful, and I think are great because then you can compare between countries better. The Organization for Economic Cooperation and Development, based out of London, is an excellent source of comparable data for the countries included in its report. From the WHO report, we can see the comparison between top 10 causes of death and the top 10 causes of DALYs, which remember are days lost. It is important to look at deaths, but we also need to see how it impacts daily living, which impacts socioeconomics, quality of life, etc. Can you see the similarities? Going back top mortality rates for low-income countries, you'll remember respiratory infections were number 1. Why is it important to know this? It helps understand what the greatest issues and needs are in a country. It helps us see what the great burden of disease really is on daily living and progression. It also helps us understand what the major factors faced by those in other countries are. If they migrate to the U.S., it helps us better understand what they've come from, what their concerns are, and what are some of their risk factors. The next 11 slides are from the 2008 WHO report and show some of the statistics related to a burden of disease. I've included them for you to just review so that you can see how your population, for clinical or personal interest, fare. As you review each slide, take particular notice of your population. You will be asked about it at the end of the section. This slide looks at the age of those who died. Although over half of those who died were over 60 years old, it is critical to note that 28% were between the ages of 15 to 59 years of age. This graph also looks at the distribution of death by age, and it compares it by region. The graph indicates that nearly 45% of the deaths in Africa occurred in children 14 years and younger. This is in comparison to higher income areas where the same age group, 0 to 14 years, make up only 1 or 2% of the deaths for that year. The data illustrated here compares deaths due to communicable, non-communicable diseases, and injuries by sex. As you can see, a greater percent of males die from injuries compared to females. However, a greater percent of females compared to males die of communicable and non-communicable disease. Over half of both males and females die from non-communicable diseases. Still looking at the differences between males and females, cardiovascular diseases are the leading cause of death for both males and females in the world. More men than women die from infection and parasite disease, cancers, and unintentional injuries. Child mortality is used as an important indicator of a country's well-being. It is often used along with DALYs to indicate the health of an area. This graph illustrates the rates and causes of child deaths by region. Africa has the greatest rates of nearly 40 deaths per 1,000 children, ages 0 to 4. The different colors indicate the various conditions: perinatal, diarrheal, respiratory, malaria, and other. You can see that malaria only accounts for deaths of children ages 0 to 4 in Africa and Eastern Mediterranean regions. Perinatal conditions account for close to 8% of deaths in Africa, yet only 1 to 2% of deaths in high-income countries. Diarrhea continues to plague many regions of the world, resulting in the death of children. Many proponents indicate the numbers are inaccurate unless you consider the number of weeks of gestation when comparing the child mortality, i.e., many young gestational babies aren't considered viable, thus aren't counted. I thought this was an interesting graph to include because it illustrates in a different way the impact of various conditions such as diarrhea, pneumonia, malaria, HIV/AIDS, and measles on children's death rates. Africa shoulders a great burden of disease for a number of different reasons. You will note several slides on children's health. Infant and children's health are critical areas to emphasize. They are the future of their country and the future of the world, hence a lot of emphasis is placed on their health. This slide looks again at causes of death among children, this time 5 years old and less. It then breaks down the 37% of the pie chart of neonatal deaths into more specific causes. Acute respiratory infections and diarrhea account for 17% and 16% of all children's deaths. Prematurity, low birth weight, account for 31% of neonatal deaths. Deaths of adults is also important to track and understand. This graph looks at the various regions of the world, the bottom axis, and breaks it down by gender and the three main groups, communicable disease, non-communicable disease, and injuries. You can see how injuries are a greater cause of death for males than females. Africa also has a higher percent of death than other regions of the world, although not that much higher than males in Europe. The cause of deaths of males in Europe is very different, however. More deaths due to non-communicable disease in Europe compared to more deaths by communicable disease in Africa. Similar to a previous graph that indicated the breakdown for children, this graph breaks down the causes of death by various regions of the world. Cardiovascular disease is the leading cause of death in Europe. Approximately 2 per 1,000 adults aged 15 to 29 died. HIV/AIDS was the leading cause of death of adults in Africa. Here is a comparison of women, 15 to 44 years of age, in high-income and low to middle-income countries. As you can see, the leading cause of disease burden is unipolar depressive disorders. In low to middle-income countries, HIV/AIDS is a huge issue. Not so in high-income countries. Here are the projections of how the leading causes of disease burden will change over the next 20 years. Mental health issues, particularly unipolar depressive disorders, are predicted to become first. This data came from WHO. It is always best when looking at a specific population to get data as local as possible. WHO is good for comparing countries and regions. However, CDC and state sites will have more local data for you to use for populations here in the US. As the past few slides have shown, many of the health issues the world faces are not just due to infection. Poverty, education, geographic location, and many social factors influence disease as well. It is critical to keep this in mind. If you're going to make substantial changes to disease around the world, and right here in Utah, you have to account for these other factors. It is the reason Greg Mortensen, author of 3 Cups of Tea and Stones into Schools, is targeting school buildings in Pakistan. He sees how education impacts society. It is for this reason that the United Nations has developed Millennium Development Goals. These 7 goals, listed above, were agreed upon as the areas which would have the greatest impact. You can see how the progress is coming. Hopefully, you can see that health, sickness, disease, etc. is greater than a healthcare system. It is about a society and a culture. If you are interested in reading more about these goals, click on the link provided here. So, what is the United States' involvement in the UN goals? The U.S. government fully supports the United Nations Development Goals. The U.S. has also been involved in a variety of other initiatives, such as the WHO's Global Plan to Eradicate Polio. The original goal was to eradicate polio from the world by 2000. That didn't happen. Although it has been eliminated in North and South America, there are still pockets of polio occurring. Above is a map showing where cases of polio currently exist. Resistance, access to remote areas, and misunderstandings related to the vaccine have caused the delay in meeting the goal. The new goal is to eradicate polio by 2015. The U.S. and other agencies, including WHO, UNICEF, Rotary Club, CDC, invested over $8.2 billion to the 2010 campaign. Various U.S. governmental agencies have assisted with funding, personnel, resources, etc. As mentioned in the previous slide, there are multiple agencies that work together to combat global health issues. Some of these organizations are governmental organizations. They include World Health Organization, UNICEF, USAID, Department of Defense, and the World Bank. It is important to have a basic understanding of these organizations. Click on each logo to navigate to each agency's website and look for each one's mission statement. Once you have done so, move on to the next slide, which is another quiz question. Other organizations are non-governmental organizations, usually referred to as NGOs. These are private, non-governmental organizations that also want to impact global health. The Rotary Club, who is helping with the polio eradication efforts, is an example of an NGO. Bill and Melinda Gates Foundation is another. A few others with whom the BYU College of Nursing works with include Charities Anywhere, Rising Star, Cristo de Hogar, World Joy, Centro Hispano, LDS Foundation, the LDS Church's Humanitarian Foundation. If you are interested in working in humanitarian aid in the future, it would be prudent to start learning about various groups and what they do. As mentioned in immersion days, you need to be careful when choosing an organization to work with. There are great ones out there. Be sure they fit your mission and goals. Be sure the majority of money the NGO raises go to the people the NGO serves and not overhead costs. Experts indicate no more than 10 to 15% of money should go for overhead or administrative costs. A final topic, a bit different from what we have discussed so far, is the global nursing shortage. I just want you to be aware that it exists. There are various parts of the world who have a critical shortage of nurses. One of the issues is that many of the best nurses are leaving their own countries and coming to the U.S. to fill the need here in the U.S., leaving their own countries in dire circumstances. It is an ethical dilemma. Should the U.S. be recruiting from areas that are already in drastic need of nurses? As a nurse, you just need to be aware of this. If you are interested in learning more on this subject, go to the International Council of Nurses Global Nursing Review Initiative, found at the link provided here. Thank you for completing the Global Health module. Press the check mark button to finish the presentation.